Hello, welcome back to my channel. It's been a while again. Ugh. I'm here to do a health update because a lot has happened since I posted a video, which is crazy because it seems like every time I come on here, it's like something new and crazy is happening, but that's just really how it's been. Like every month is just crazy. So, last time I came on here, I was talking about how I had just gotten diagnosed with something called idiopathic intracranial hypertension, and that it was affecting my vision. I explained everything in that video, and I also had explained, as most people already know from a video I did a little while ago, I also have something called aspirin exacerbated respiratory disease. I'll link those down below if you want more details or a refresher on what those are, because this is going to be an update about my treatment and what has happened so far and what's probably going to be happening in the future and how we know that it's going to be happening. So let's start with my IIH, my idiopathic intracranial hypertension. So last time I came on here, I had just done a spinal tap. So I've been officially diagnosed. I had started a drug called Diamox, and I was taking 500 milligrams 2 times a day. And that was that. And we were just going with that. I was still recovering. About a week after I had filmed that video, I had a drastic change in symptoms, a headache, that I would get this like raging headache every time I wasn't laying flat on my back. And I was showing textbook symptoms for a spinal leak, which we do believe that I had one from, like I said in the video, I had gotten poked 3 times by the doctor who did my spinal tap, just because the way I was positioned and all that, it was hard to get it in the right spot. So because of that, I likely did have a small leak, but it recovered on its own. I never had to go in and get a patch done. Thank heavens. That would have been crazy. I'm glad it was able to heal on its own with just like sheer like bed rest and making sure I only get up to go to the bathroom and like drinking tons of water. And it did go away. After that, I actually felt okay for like a week. And then my head pressure came back fairly quickly and very aggressively. Like I almost wasn't expecting how fast it was. It was like one day I was fine, and then the next day everything hurt like I had never done it. So I emailed my doctor and he upped my Diamox. And this continued. I would feel good for a little bit, he'd up it. I'd feel good for a little bit, he'd up it. Currently, I'm now on 2,000 milligrams of Diamox a day, which is 1,000 in the morning, 1,000 at night, which is double since I've started. And yeah, that's where we're at currently. Because the Diamox kept needing to be upped, we decided we were gonna schedule an appointment with my ophthalmologist, which I already had booked. And if my optic nerves looked worse, we were gonna do further testing to see if I needed a stent or a shunt. So I went to my ophthalmologist and my optic nerves looked worse. So despite having started the Diamox and despite doing the spinal tap, my optic nerve was still very inflamed and showed no sign of progress. And it had been several weeks. Optic inflammation doesn't just go away overnight. It does take time to reverse, but within a couple of weeks, there should be some improvement, or at least it should look the same. And mine looked worse, even with having the things that I had mentioned. So we knew it was time to look into other options. So he did I believe it's called an MRV. It's like a type of brain scan, I think it's a CT scan, MRI. It's a type of MRI, sorry. And it's called an MRV. And that came back that one of my, I guess like in your brain, there are things called sinuses. They're not like the sinus issues I have now, but there's like openings throughout your brain where like the spinal fluid like flows through. And you only need like, I believe if I understand correctly, I believe you only need 1/2 of your brain to work like properly. And it's common for people to only have like one side working. And on mine, where it's supposed to be working, it's really pinched off in one area. So we believe that I may be a candidate for what's called a stent, which I'm actually really excited about because it's much less invasive than a shunt. A shunt is a catheter where they cut open your head and put a catheter in your brain, and they run a tube from that brain all the way to your stomach. And it's very invasive. Recovery is really brutal, and shunts tend to have malfunctions. People need to have repair surgeries done. If I were to get in a car accident or anything crazy, like, I'd have to constantly get it checked up on. So it's not like I'm not saying that a stent isn't as much of a commitment. It's just not as invasive as a procedure as a shunt is. And I would rather start with a stent if I'm a candidate, because likely that's going to be in the long run what I need, and not a shunt. So it's more like you don't just get to pick which one you want. It's kind of like whatever issues are causing the buildup of fluid, that's kind of the treatment plan you go with. And I feel like I'm really lucky that my area is just pinched off, because if it's as simple as a stent, I will be very lucky, and that would be amazing with me. But it is always possible that I could get the stent put in, and then I might in the future still need a shunt. So because I have the narrowing, they are gonna repeat the scan, but with contrast this time, just to verify that they are seeing what they're seeing, because I guess there was some interference on the results. So even though he's pretty confident that that is what he saw, he does want to do another test just to be sure. And if he sees what he sees, I'm going to be sent to a specialist who can talk to me about getting a stent put in. A stent is, I'm just going to vaguely say this because I'm not a doctor, but from what my own research has been, because I have not met with a specialist yet, so no specialist has told me how they do stents or like the prep work involved. But just from my own research, they believe they go through a main artery in your leg or your arm, and they go up that artery to your brain, and they put like I don't want to call it a tube, but I guess it is. It's like a flexible tube that's meant for your brain, I guess. And they put it in the area where it's very narrow. And before they can do that surgery procedure, they do have to do what's called, I think, an angiogram. It's some sort of, it's basically the same procedure, but while you're awake, and they do it just to verify where the narrowings are and to show where exactly they're going to place those tubes. And I have seen some videos on YouTube. I will link them down below, because there was one that was like super helpful, and she was really informative, and she talked about her experience, and I'll put that down there. But she had even said that with her doctor, they did I'm pretty sure it's called an angiogram, but they did the test one and the surgery on the same day. So they didn't have to do like two separate like procedures, but some doctors do them on separate days. So we'll see what happens with that. That's kind of where we're at with my IIH. Now let's talk about my AERD, because they kind of do go hand in hand as far as treatment goes. So obviously for my IIH, I still have to do another scan, and I have to meet with a specialist before anything of that sort gets dealt with. So for now, I'm not on hold with that, but I do have to wait. It is a process, unfortunately, to get treatment. I can't just walk in and be like, "Hi, specialist, treat me now." Like, there is a wait to get tests done and things. So I just have to wait for that to happen. But with my AERD, we have been for a little bit like at a standstill, because I had this new condition. We didn't know what it meant as far as like how permanent it was going to be, or how long it's going to have to be on Diamox. We didn't have a lot of information to determine what would be the best treatment. So I got the flu about a month ago. It was really brutal. And of course, with the flu, you can have coughing, sneezing, all that. Anytime I get any cold or sick to any extent, I will instantly get a sinus infection. It happens every single time. The only time I've ever gotten a cold and not had a sinus infection is when I was already on a prednisone taper, which means I was already on medication that would have helped it. So it prevented the infection from happening. So I've always so I ended up getting a sinus infection. I messaged my ENT. He put in the prescription for me to get antibiotics and steroids, and I started it. And then that's when he had talked to me And he was like, hey, I see you still haven't met with the allergist about starting Dupixent. I think you should really check with him and see if it's like, if you're a candidate, because I think it would work really well for you. Otherwise, you're just going to keep getting these drugs and you're going to need to get a surgery eventually. So I was like, okay. So I finally booked the appointment, and that appointment was this morning. So I go in to see my allergist, and he always does like a lung function test before. And my lung function was at 93%, which is great. I also, he also looked at my sinuses, but they don't, like my ENT, my specialist, when he looks at my sinuses, he has this like long metal rod, and he can like go up my nose and like look into my sinuses, where my allergist, he only has like the little, like the ones like a primary doctor would have. So he can tell that there's no polyps going into my nostrils, basically. So he's like, yeah, it looks fine as far as like from this standpoint. But of course, he's like well aware that polyps grow in your sinuses and not just like in your nose. So he was like, it looks fine from here, and your lung function test looks pretty normal. And he actually seemed like, I got the impression that he almost didn't want to talk about Dupixent at first. But I was telling him about how my polyps are shrunken, because last time I saw my ENT was in October, and it's currently December. And last time I saw him, my polyps were shrunken. They actually looked pretty good. It was almost like I didn't have any because they were so small. It was kind of like if there's a trash can and like it's full of like fluffy stuff and you step on it and you compact it. That's kind of what happens with polyps. So like it can make things look a lot smaller and a lot better, and you can go a lot longer with that treatment because you don't need to, like, it's like taking out the trash just for like plastic bags without compacting it. You know what I mean? So it's like, of course they're going to look good, but I still have polyps, if that makes sense. And so my asthma was doing fairly well, and my polyps were looking fairly good. So he was kind of like, what brings you in? And so I told him, I was like, well, I'm currently on prednisone. I've been on it for, I think I only have like 5 days left. So I've been on it for 15 days. And I told him about how I have to be on prednisone pretty frequently. And so then he's like, all right, well, let's just bring up your prescription and we'll see how often it is. And to be honest, I didn't know, I couldn't give him an answer. I don't even know how often I need prednisone. I just know that I take it a lot, like a lot more than I should, because I know a lot of prednisone's not good. So when he brought it up, he was like writing down the dates of like how often, and it was every 2 or 3 months I was taking a 20-day pack of prednisone. That's a lot of prednisone since like January. That's a lot of prednisone. And so he was like, yeah, that's an issue. And basically explains why my symptoms have kind of stayed the same this whole year. It's not because my symptoms just like disappeared. It's because I've been on prednisone basically this whole year. Because if you don't know about prednisone and how it works, you start off really, really strong. You start off, for me, it's usually 5 days of 4 pills, and then the pills are like a certain size. And then after the 5 days, you go down to 4 pills of the same size, and then 3, and then 2. And so you taper off of it, and it totals out to 20 days. And that's why I call it a prednisone taper, because you taper off of it. I had done that a lot. And if you think about it, every 2 to 3 months, that means that's just in between me getting refills, which means really only 1 to 2 months I'm not on prednisone, because 20 days is basically a month. So I'm on prednisone a lot. And so he was kind of like, well, if you were to go to your ENT right now, you're going to look great because your polyps are shrunken. You're on prednisone, so they're going to look good. That's probably why because I've been having issues with my asthma too. And my lung function test came back great. And so I had like emailed him, and I was like telling him about my issues with asthma a couple weeks ago before I'd started it. And now I'm like, oh, my asthma's fine because I'm taking prednisone. So what we're going to do is I'm going to possibly be getting a new preventative inhaler. I'm currently on Alvesco, and I'm probably going to be getting a discus inhaler instead, which would be great because I've been needing my rescue inhaler about 2 to 3 times a week. And he's like, I'm not so worried about 2 times a week, but if you're doing 3 times or more a week, you really should be getting a stronger preventative inhaler because you shouldn't be using albuterol that much. So I said, okay. So I'm supposed to like monitor more accurately how often I'm using it this next week or two, and then email him. And so we can go from there with that. So that'll help with my asthma. And then we were talking about treatment for the nasal polyps. So obviously, if I go into my ENT, my polyps are shrunken. He's not going to see anything. But in 3 months, they will not be. So the plan for now, which I'm kind of scared about, but I also know like it's important. Like if you think about it, like to get a diagnosis, you need like data to like show, like to prove your symptoms, I guess. And like I've been having these symptoms and my ENT sees them, but like my allergist is just like, where are your symptoms? I'm just seeing you on prednisone all the time. So I'm gonna go 3 months. Of course, the goal would be no prednisone, but I'm gonna go the 3 months without prednisone. And then I'm gonna go see my ENT and we're gonna see what my polyps look like. And if they look as bad as I think they're gonna look, which is, that's how it took 3 months last time to go from no polyps to polyps. So I'm kind of nervous how I'm gonna go from where I'm at now, where I have polyps that are shrunken, to like, I don't know what I'm gonna be 3 months after that. So we'll see. And if my polyps do grow, then they are gonna start me on a drug called Dupixent, which has just been released this year by the FDA for the treatment of asthma and nasal polyps. For a long time, this drug was mostly treated or only used, released by the FDA for eczema, and it's recently this year been released for nasal polyps and asthma. And a lot of people that I know who have AERD, I am wearing my shirt today. So on the Samter Society, which is like a Facebook support group that I'm a part of, a lot of people have been logging their reactions and how they've been feeling and doing with Dupixent. And a lot of them have been doing great. They have like minor side effects, like I think their lymph nodes, I think that's what these are. They like hurt. And then like there's been some other side effects, like, and of course everybody's different, but all of it seems to me fairly manageable. But of course, nobody knows how individually you're going to react to a drug that you've never tried before. And Dupixent is a biologic drug, which means it's an injection that you would give yourself in your stomach or your leg, and it would suppress part of your immune system. So that way your body no longer overreacts like mine does to cause the polyps and the asthma. So that's the goal of it. But because it's just now been released by the FDA, we don't really know, like 5, 10, 20, 30, however long I'm on this medication, we don't know what the side effects are going to be. We don't know what that suppressing of that part of the immune system could do over time. But we do know that currently that part of my immune system is overactive. So it's kind of like, we don't know, we'll see what happens. But I don't really have any other options because currently being on my medication for IIH, I can never be aspirin desensitized while on Diamox. Diamox says all over, a pharmacist will tell you, do not take aspirin, not even a low dose with this medication unless you absolutely have to. And with aspirin desensitization, it's a high dose aspirin morning and night. So that's like a complete no-no. If I were to get the stent and by some miracle it cures me and I never need Diamox again, then definitely aspirin desensitization is another option. And maybe if I don't like Dupixent, I could switch. Or I've heard many people who do both, who do Dupixent and aspirin desensitization. So I don't know what I'm going to do in that regard, but those are possibilities. If I can get the IIH taken care of. But if I can't, then really Dupixent's like my only treatment, like long-term treatment plan other than prednisone. And don't get me wrong, I like prednisone in the way that when I take prednisone, my symptoms get better. I feel more normal and I can do more things, but I know prednisone is not good long-term. There's been so many studies about prednisone and how it affects people differently, and how it can attack different parts of your body long term. And especially since 2016, I've had nasal polyps between 2015 2016, I had several bursts of prednisone, and since then I've had numerous bursts of prednisone. So I've already done, like, what is that, 5 years? Not 5, it's 2019 still, technically, even though it's almost the end of December. But it's been like 4 years that I've been doing frequent prednisone bursts multiple times a year. And this year, especially since my AERD has really kicked into overdrive, I've needed it heavily. I've really like relied on that medication to kind of treat my symptoms, and it's not good. So I'm hopeful that I'll be able to start Dupixent, but I also am well aware I do technically need brain surgery at some point, more than likely, if I get my stent. And I'm sure they don't want to just like start injecting me with these new medications and then send me off to brain surgery, because then we won't know what's a side effect of medication and what's a side effect of the procedure. And not only that, Dupixent does say on their directions, I don't know if directions is the right word, but on their information sheet that they give to doctors, because we went over it today at my allergist appointment, it does say that you should not take Dupixent if you have vision issues. And it was kind of vague, the wording, and I'm sure for good reason, but I have an inflamed optic nerve currently that is not being treated. It's getting worse until I can get my brain procedure done. So I am going to talk to my ophthalmologist next time I see him and talk to him about this drug and see if he can look into why or basically see if there's a reason why I wouldn't want to start it, and if it would be okay for me to start it, or if I should wait until after we can get the inflammation down. The goal, of course, is to get the stent and get it to go down on its own without having to do a surgery on my eye to reduce the inflammation on my optic nerve. Because over time, if your optic nerve stays inflamed, it could actually start to die, and I could actually go blind. Thankfully, that hasn't happened. I have lost some of my vision since getting this issue, but definitely not anything crazy. I have lost my peripheral vision again. It's back to how I was. It's back to how I was before my spinal tap, which is like at least when I did my field of vision test, it was very like my vision's more narrow. And I still have the blind spots. And every now and then I do get visual, I don't know if disturbances is the right word. That almost sounds paranormal, but I do get moments where like an eye will go black, or both eyes will go black for like 30 seconds and then it'll come back. Or if I itch my eyes in any way, shape, or form, or put any excess pressure on my eye in any way, if Isaiah headbutts me without my glasses on, I will lose vision in an eye for like a minute, and it takes a while for it to like come back. So I definitely do have vision issues. So I wouldn't want to like just disregard those issues and be like, just start me on Dupixent. I do want to take them seriously, because even though IIH vision issues can be temporary, if you do a lot of damage, they can be permanent. And I would hate to go permanently blind because I was really eager to jump into a medication after my doctors had warned me to like look into it. So that's where I'm at. I'm looking into it. I will let you guys know how it goes with my doctors in the future and what they say. And I am going to try and vlog my stent. I don't know about like the actual procedure. That seems a little crazy, but I do want to vlog my hospital stay. I have a friend that's willing to help me. And then I also will definitely be documenting my Dupixent injections and starting that and my symptoms and all of that. So if you're interested, please hit subscribe, and if you like this video, so that way I know for sure that that's what you want to see. And if you have any recommendations, just leave them in the comments and I will be sure to make a video. I'll see you guys next time. Bye.